After the age of 50, there is an important difference between simply staying active and actually preparing your body to remain strong. Walking is important. Climbing stairs is important. Continuing to perform everyday household activities also helps keep your body moving. But there is something many people do not realize. Your body adapts specifically to the demands you place on it. If you always perform the same movements, at the same intensity, and in the same way, your body becomes efficient at those particular tasks. But that does not necessarily mean it is prepared for different situations. In real life, we need to move in many different directions. We need to lift a leg to step over an obstacle. We need to control our body when stepping backward. We need to use our hips when bending down. We need ankle stability when walking across uneven surfaces. And sometimes we need to react quickly when we momentarily lose our balance. That is why adding variety to your exercise routine can be so valuable. In this workout, we will use 6 different movements to train the lower body more completely. We will challenge the quadriceps, glutes, hamstrings, calves, hips, and several muscles responsible for stability. But there is another goal. We want to teach the body to produce and control force in different positions. Because strong legs are not only useful during exercise, they support the life that happens outside your workouts. Each exercise in this program has a specific purpose, and when we combine them, we create a routine that develops strength, balance, coordination, and control. Let's begin. Exercise number 1, seated knee extension. Let's begin by strengthening the quadriceps, the muscles located along the front of your thighs. They contribute to fundamental movements such as standing up, walking, climbing stairs, and controlling the knees. Sit on a stable chair. Keep your back comfortably upright and both feet on the floor. Now slowly extend one leg. Raise your foot until your knee is close to a straight position without aggressively locking the joint. At the top, contract the muscles along the front of your thigh. Maintain that contraction for approximately 1 or 2 seconds. Then slowly lower your leg. Do not simply allow it to fall. Control the lowering phase. Perform approximately 10 to 15 repetitions. Then switch legs. Complete 2 or 3 sets on each side. The movement may look simple, but when performed slowly, it can provide an effective muscular challenge. Think about 3 phases. Lift, contract, lower slowly. The greater your control, the better the quality of each repetition. Exercise number 2, lateral step and return. The second exercise completely changes the direction of movement. During most of the day, we primarily walk forward. As a result, lateral movements are practiced much less frequently, but they are important. The ability to take a controlled step to the side may be useful when moving around an obstacle or recovering your body position. Begin standing with your feet approximately hip-width apart. Keep a chair or countertop nearby in case you need support. Now take a comfortable step to your right. Transfer part of your body weight onto that leg and slightly bend your knee. Your left leg should remain more extended. Keep your chest upright. Then press through your right leg and return to the center. Now repeat toward the left. Continue alternating. Right, center, left, center. Avoid rushing through the exercise. We want you to feel the transfer of body weight. Perform approximately 8 to 12 repetitions on each side. Complete 2 or 3 sets. If the movement feels difficult, use smaller steps. As your confidence improves, gradually increase the lateral distance. This exercise strengthens the legs while teaching your body to control movement in a different direction. Exercise number 3, glute bridge march. Now we are going to the floor to work the glutes, hips, and trunk stability. Lie on your back, bend your knees, and keep both feet completely flat on the floor. Your feet should be approximately hip-width apart. Lightly brace your abdominal muscles. Press your heels into the floor and slowly lift your hips. Now maintain this position. Without allowing your hips to drop toward one side, slowly lift one foot a few inches from the floor. Place it back down. Then repeat with the opposite foot. Right, left, right, left. Think about performing a small marching movement while keeping your hips elevated. The challenge is not lifting your foot very high. The challenge is maintaining a stable pelvis while your support changes from one leg to the other. Begin with approximately 6 to 10 lifts on each side. Then lower your hips and rest. Complete 2 or 3 sets. If this version feels too difficult, begin with a traditional bridge while keeping both feet on the floor. Only progress to the marching variation when you are ready. Progression does not mean skipping steps. It means mastering one stage before moving to the next. Exercise number 4, toe walking. The fourth exercise primarily targets the calves and ankle control. Your calf muscles are constantly involved in walking. They help propel your body forward and also contribute to stability. Stand close to a wall or countertop. Now slowly raise your heels. Balance on the front portion of your feet. Maintain this position and begin taking small steps forward. Do not rush. Use short steps. Keep your heels elevated. Begin with approximately 6 to 10 steps. Then lower your heels and rest. Repeat for 2 or 3 sets. If walking in this position feels too difficult, there is an easier version. Simply remain elevated on your toes for 10 to 20 seconds. Once that becomes comfortable, begin adding small steps. Always perform this exercise close to a stable support surface. The goal is not to test how far you can walk. The goal is to strengthen your calves and ankles while maintaining safety and control. Exercise number 5, pause squat. Now we are going to use a squat variation, but this time there is one important difference. We will add a pause during the movement. This small change increases the amount of time your muscles must work and removes some of the momentum that can be used to stand back up. Stand with your feet approximately shoulder-width apart. If necessary, keep a chair in front of you for support. Slowly push your hips backward. Bend your knees. Lower yourself to a comfortable depth. Now stop. Maintain this position for approximately 2 or 3 seconds. Continue breathing. Then press your feet into the floor and slowly return to the starting position. You do not need to perform a deep squat. A smaller range performed correctly can be much more useful than descending too far and losing control. Perform approximately 8 to 10 repetitions. Complete 2 or 3 sets. As your strength improves, gradually increase the duration of the pause. For example, 2 seconds, then 3, then 4. This is a simple way to make the exercise more challenging without adding external weight. Exercise number 6, backward step and tap. To finish the workout, we are going to practice a different ability, controlling the body while stepping backward. Normally, we can clearly see the space in front of us, but when we move backward, we depend much more on body awareness and balance. That is why we will keep this exercise simple and safe. Stand close to a countertop or stable chair. Keep your feet approximately hip-width apart. Now transfer your weight onto your left leg. With your right leg, take a small step backward and gently touch the floor with your toes. Do not transfer all of your body weight backward. Simply tap the floor. Then bring your foot back to the starting position. Repeat with the opposite leg. Left, center, right, center. Keep your torso upright and perform each step slowly. Complete approximately 8 to 12 repetitions on each side. Perform 2 or 3 sets. As your confidence improves, you can gradually take a slightly larger step, but always keep a stable support surface nearby. This movement helps develop coordination, stability, and confidence during changes in direction. How to organize the workout. We now have a sequence of 6 exercises. Seated knee extension, 10 to 15 repetitions on each side. Lateral step and return, 8 to 12 repetitions on each side. Glute bridge march, 6 to 10 repetitions on each side. Toe walking, 6 to 10 steps. Pause squat, 8 to 10 repetitions. Backward step and tap, 8 to 12 repetitions on each side. Begin with 2 sets. If you feel comfortable and can maintain good technique, gradually progress toward 3 sets. Rest approximately 30 to 60 seconds between sets, or slightly longer when necessary. And remember that you do not need to make every exercise more difficult at the same time. Adding 2 repetitions can be progress. Performing the movement more slowly can be progress. Needing less support can be progress. Improving the quality of your technique can also be progress. There are many ways to improve. If there is one message worth remembering after this workout, it is this. Your body needs to continue being challenged if you want it to remain prepared. That does not mean performing extreme exercises. It does not mean finishing every workout completely exhausted. And it certainly does not mean ignoring your body's limits. It means providing appropriate physical challenges consistently. Today we practiced 6 different movements. We strengthened the quadriceps with the seated knee extension. We trained lateral movement with the lateral step and return. We challenged the glutes and stability through the glute bridge march. We trained the calves and ankles with toe walking. We increased squat control by adding a pause. And finally, We practiced backward movement with the backward step and tap. When we look at each exercise individually, these movements may appear very simple. But that simplicity is exactly what makes this type of training so valuable. Because many of the movements that determine our independence are also simple. Standing, sitting, walking, turning, climbing, descending, stepping sideways, recovering your balance. The problem begins when something that should be simple starts becoming difficult. That is why we should not wait until we lose an ability before we begin appreciating it. Think about balance. For much of your life, you probably never had to consciously think about it. Your body simply made the necessary adjustments. But balance also depends on practice. Strength depends on stimulation. Coordination depends on movement. And endurance depends on use. These abilities need reasons to remain active. There is also something important about aging that deserves to be remembered. You do not need to train exactly the way you trained at 20 to experience benefits after 50. Your training can change. Your speed can change. Your volume can change. Recovery may require more attention, but that does not mean your body has stopped responding. The key is finding an appropriate challenge. An exercise that is too easy may not provide enough stimulation. An exercise that is excessively difficult may compromise technique or create unnecessary risk. Between those two extremes is a level where you can work, learn, and improve. That is where we want to be. Maybe today you need a chair for support. Use it. Perhaps you can only perform 6 repetitions. Start with 6. Maybe you cannot perform every exercise. Choose the movements you can perform safely. Your starting point does not determine where you will finish. It simply shows where you are today. And there is something powerful about noticing small improvements. Imagine performing 10 repetitions of a movement when you could previously perform only 6. Imagine needing only 2 fingers on a chair when you once needed both hands. Imagine climbing a staircase and realizing your legs do not feel as tired as they used to. These changes may appear small when viewed individually, but together they represent something much larger. They represent capacity, and capacity creates confidence. When you trust your body more, you are more likely to move. When you move more, you provide your body with additional stimulation, and that can create a positive cycle. More movement, more capacity, more confidence, more independence. So do not think about exercise only as the minutes you spend training. Think of it as an investment. You are using a few minutes today to help preserve abilities you want to continue using tomorrow. Always respect your limits. Mild muscular soreness after a new challenge can occur, but significant pain, dizziness, or unusual symptoms should not be ignored. If you have important physical limitations, a history of falls, or a condition that may affect exercise safety, seek professional guidance so the program can be adapted to your individual needs. There is nothing wrong with modifying an exercise. In fact, knowing how to adapt is one of the smartest ways to continue training. The goal was never to perform every movement exactly the same way as someone else. The goal is to find movements your body can perform and progressively improve from there. Because true strength after 50 is not demonstrated only inside a gym. It appears when you can stand up independently, when you can walk confidently, when you can keep up with your family, when you can travel, when you can get in and out of a car, when you can climb a staircase, when you can maintain your routine, and when you can continue making your own choices without allowing unnecessary physical limitations to make those choices for you. That is what we are training for, not simply to complete 6 exercises, but to preserve 6 much greater things: strength, balance, mobility, confidence, independence, and freedom.